Hi, I'm Emily Bendlin, a pediatrician with Methodist Physicians Clinic. The first 2 weeks at home with your newborn are a joyful and exciting time. There can also be some uncertainty as you get to know each other. Let's talk about what to expect. Your newborn's tummy is small, so it's normal for them to feed frequently. Most babies feed 8 to 12 times a day or every 2 to 3 hours. Your baby may also cluster feed. This is when they want to feed more frequently for shorter periods of time. It can be followed sometimes by longer periods of sleep. Talk with your doctor about if your baby's feeding pattern is normal. Most newborns lose weight in the days following birth. During birth, your baby takes some amniotic fluid with them, so it's normal to lose weight as they lose that fluid. It also can take days to master breast or bottle feeding, but most babies are back to birth weight by 10 to 14 days of life. For the first few days of life, your baby's stool is greenish black and sticky. It's usually known as meconium. Once this is passed, the stools become yellow and green. Breastfed babies usually have yellow and seedy stool, whereas formula-fed baby's stool can be darker and pastier. Some babies stool with each feed, others only a few times a day. Your doctor can help you decide if your baby's patterns are normal. About half of all newborns have some degree of jaundice, which is a yellowish tint to the skin and eyes. Most cases are harmless and go away on their own. Breast milk and formula can help get rid of bilirubin, which is the chemical that causes jaundice, so ensuring good feeds is one of the best treatments. Call your doctor, however, if you feel that the jaundice is getting worse or if your baby is feeding poorly. Your baby's umbilical cord will dry and fall off on its own in the first few weeks of life. Until then, keep the umbilical stump clean and dry. Keep the diaper folded under the area to avoid covering the stump. If it gets dirty, use a cloth and water and avoid using rubbing alcohol. I recommend sponge baths until the cord falls off on its own. Most newborns only need a bath a few times a week. When bathing your newborn, use a flat, warm surface. Gather everything you need beforehand and never leave your baby unattended. When bathing, start at the head and work down, and make sure to only expose the parts that you're actively washing. It may be difficult to tell whether your newborn's behavior is normal or a cause for concern. Some general signs that it might be time to call your pediatrician include if your baby has a fever of 100.4 or higher, if your baby's breathing pattern seems abnormal, or if your baby is breathing fast, if your baby has less than 3 wet diapers in a 24-hour period, as that can be a sign of dehydration. Also call if your baby is inconsolable or sluggish, if the umbilical stump seems infected, or if your baby appears ill. No one knows your baby better than you. Trust your instincts. If you feel something's wrong, call your pediatrician. We're here to help.